given all this, you can understand why health experts are calling the Moderna vaccine announcement this morning some welcome news. Dr. Gabe Callan is an emergency physician at Johns Hopkins University, and he's joining me now from Baltimore. Dr. Callan, can we start first just by asking your reaction to this Moderna news today? What do you think?
This is very exciting, particularly coming on the heels of the Pfizer announcement just a week ago. And one of the reasons that this is so exciting right now is for the last 8-9 months, we've been absolutely ground down psychologically, in some cases physically, by curtailing our activities, wearing masks, staying indoors, not being able to see our families and friends and so forth. And it's really taken its toll. And now with this new surge, we're asking everybody to do it all over again or to stay the course. And obviously the surge that we're seeing throughout the country and the world is a lot of people have just fatigued. But now there's hope. There's like real light at the end of the tunnel. And so now when we ask people, just hang in there for a little bit longer, as Dr. Fauci said, second or third quarter, life can perhaps return to some true normalcy. That allows us to really hang in there that much better.
When you were describing the way that what ultimately became the way we were feeling, people who were not on the front lines about being hunkered down, wearing masks and not seeing family, I at first thought you were going to explain to us how emergency physicians have felt, because it's just no comparison compared to the way that us non-frontline health workers have felt. Give us an idea of what you and your colleagues have been going through over the last 9 months and how that's changed over the last 2 weeks as hospitals are filling up more.
Sure. So this has two sides. We are just like everybody else out there in society. We have families. We worry about our families. We worry about our children. We worry about our elders, and we worry about our friends. And we can't see them just like everybody else. And so we can't go to restaurants. We don't go to movies. We don't go to sporting events. So there's that side. But then every day that we see patients clinically, although fortunately PPE is appropriate and adequate now in the vast majority of places, every day is a reminder of the physical threat to our health when we see patients. And we gladly see them. We do want to take care of them. But when we get overwhelmed because there are too many cases, that has a whole other psychological overlay. You become truly physically exhausted. Many of our nurses are burnt out after 9 months of unrelenting effort of taking care of patients.
Yeah, there was this article in the New York Times over the weekend about doctors who've actually just given up their practices because they haven't been able to keep going through this pandemic. Do you think we're going to see some permanent changes hit your profession because of the pandemic?
For certain. So most of us are going to recover psychologically. I think that's probably the case, but not everybody will. And I've had more physicians this year tell me that when this is over, they're going to hang up their skates.
Wow.
They're done. They're here. They're going to see it through because they feel they have an obligation to see it through. And there aren't very many excess people to help out. But after this, they're done.
Wow, that really is a really sobering thing to think about. The people who are protecting us and taking care of us are going to be done after this because of what they've gone through. And by that time, it'll have been, I think, a year at least. Dr. Callan, I'm wondering about a message that you have for people right now who are thinking about seeing family and traveling over the Thanksgiving holiday. What do you want to tell them?
Well, the same thing I'm telling my own family. Don't do it.
Yeah.
Or take extraordinary precautions. There is light at the end of the tunnel. Don't rush it. With things burning completely out of control right now, you're taking a big chance. And the way to really look at it is that when you get infected, it's not only about you. It's you're spreading it to other people, and you have no idea who you're killing. And we should really look at it that harshly. When you spread this to somebody else, inadvertently or otherwise, you have no idea who you're harming. So it's not only about you and your families. Take extreme precautions during this holiday period.
Dr. Gabe Callan, Johns Hopkins University emergency physician, thanks so much for your time. I like thinking about this in the sense that we are hunkering down for some light at the end of the tunnel. So thanks for leaving us with some optimism today.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.